the Mediterranean diet. We talked about this before, and I'm going to simplify what it is so you can try it for yourself. So this all comes from the PREDIMED trial. They took over 7,000 people, divided into 3 groups. The control group, group number 3, just consumed a low-fat diet. And then the experimental groups, group number 1 and 2, they both consumed the Mediterranean diet. One of them focused on increasing extra virgin olive oil consumption, and the other one focused on increasing mixed nut consumption. They followed them for almost 5 years, and they found that there was a 38% lower risk of AFib in the group that consumed the Mediterranean diet with extra virgin olive oil. Now, there was a little bit of a benefit in the group that consumed the Mediterranean diet with mixed nuts, but the olive oil edged out the mixed nuts. Better benefit. Also, heart failure, better benefit with the Mediterranean diet with extra virgin olive oil. Heart attack, stroke, death from cardiovascular causes, 31% lower in the Mediterranean diet with olive oil. Type 2 diabetes, 40% lower. Breast cancer, 69% lower. All these benefits, big, huge, tremendous, unbelievable benefits from the Mediterranean diet with extra virgin olive oil. The most remarkable thing about the PREDIMED trial is no total calorie restriction was advised, nor was physical activity promoted. That's a big deal because these people aren't really focusing on weight loss, right? They're not even adding exercise. All they're doing is changing their diet. That's great. What is the Mediterranean diet? We talked about this a little bit before in a previous video. The Mediterranean diet, this is the table taken from the PREDIMED trial that outlines the Mediterranean diet that they used. Now, there's a little bit of a disagreement between like this definition of the Mediterranean diet and other definitions. So I took this and I combined it with data from the Mediterranean Diet Foundation, which many would consider to be the gold standard on defining what the Mediterranean diet is. You'll see at the top of the pyramid they have wine in moderation. Now, if you're consuming this diet to minimize your risk of atrial fibrillation, you're not going to consume wine because wine contains alcohol, and alcohol increases the risk of AFib. For every daily drink of alcohol, there's an 8% increase in the risk of AFib. So we're not going to do that. You could consume like a de-alcoholized wine or a non-alcoholic wine, but that would be just basically for people who are already in the habit of consuming wine and they want a substitute that's non-alcoholic that's not going to increase their risk of AFib. So I took this pyramid, this food pyramid, the definition essentially of the Mediterranean diet according to this foundation, and I combined it with the data from the PREDIMED trial, their definition of the Mediterranean diet, and I made my own kind of chart to track weekly adherence to the Mediterranean diet. And basically, I wanted to use the PREDIMED trial as the foundation, and then when there were big discrepancies between the PREDIMED trial definition of the Mediterranean diet and the Mediterranean Diet Foundation definition, I went with the Mediterranean Diet Foundation definition. So basically, on the far left, it's all green. So what that means is you can consume as much of that as you want. So the goal is 4 servings a day of fresh or frozen vegetables, and you can go above that. That would be great, but the goal is at least 4 a day. Fresh or frozen fruits, 3 a day, but more servings would be better. Whole grains, bread, pasta, 3 servings a day, but more is fine. Whole grains in particular would be better than, say, bread or pasta, but the Mediterranean diet does not differentiate between those. Nuts, peanuts, seeds, I specified peanuts there because some people might argue, well, that's a legume, so you should include that with like beans and lentils, etc. But they count peanuts in the nut group there, and you should aim for 2 servings or more a day. And so that as you can see, this is a weekly goal chart here. So that would be 14 servings a week or more. So more is fine. So green means good, so you can go more if you want. Herbs, spices, garlic, onions, 1 serving a day or more. Fish or shellfish, 3 servings a week or more. Beans, peas, lentils, 3 servings a week or more. Sofrito, 2 servings a week or more. Sofrito is like garlic, onion, tomato, simmered in olive oil. So a lot of dishes can be started that way, and that's kind of the base of the dish, and then you can build on that when you're cooking. Then we have dairy, low-fat dairy, egg whites. I put egg whites there because there's a lot of research that suggests that the egg yolk could be potentially problematic. And there's conflicting, the results are conflicting. Like there's some that says, that's fine, and other research says, well, it's probably going to be really bad. So I say, you know what, let's play it safe. Let's do 1 egg yolk a week. So I put that over here in the red zone. 1 is fine. But then egg whites, you can go buck wild and do, like, I said aim for 6. That's basically just for the protein, but that was sort of I'm sort of still in limbo on that. I may edit that, but that just kind of explains my line of thinking there. Poultry, 2 servings a week or more is fine. And then these red zone, these are rigid limit things here. So potatoes, you don't want to eat too many. Some is fine. They have a lot of nutrients, but they're also pro-inflammatory. Whole eggs, like I already talked about. Red meat, terrible, but 1 serving a week is fine. Dark chocolate is 1 serving a week. All this stuff, you can read it for yourself. But basically, like I said, I hybridized the Mediterranean Diet Foundation definition with the PREDIMED trial definition of a Mediterranean diet, and I made this chart. Now, extra virgin olive oil and water and herbal infusions are on the far left. You can have as much of that stuff as you want. You're not having really any like soda, hopefully. You're just drinking a lot of water. Herbal infusions. Herbal infusions would be like teas that don't have any actual tea in them, right? So they sell these herbal teas. They're like peppermint tea, chamomile tea, hibiscus tea. Those are all good. So those are, as much as you want, you can have that. And then extra virgin olive oil. Make sure you're getting a good one. There are a lot of fake extra virgin olive oils out there, so you really have to do a lot of research to find a good one. I found a few good ones. I don't want to talk about them yet because I'm not 100% convinced that they're the real deal, but you do have to do a lot of research to figure that out. So this is the app I mentioned in the previous video. So I use the Tally app. So this is the app Tally, the anything tracker. This is what I'm using. There are other habit trackers out there that can be used, but just showing you the one I'm using. Also, this is what it looks like on my actual app. I have fruits. I want 3 servings a day, vegetables 4 servings a day, etc. So every time I tap one of these boxes, it adds the number on the left-hand side. So this morning I had a serving of nuts for breakfast, so that's 1 out of 2 of my daily goal. So if you want all of these benefits, you've got to take this and you've got to plug it into something that you can use. You could just like make a chart like this and use a pen, or you could plug it in to an app like this. Now, another tip, I found that it's harder for me to actually get these servings in if I don't focus on it. So if I don't make this like my very first thing of the day to get like a couple servings of nuts and fruits and vegetables, then I find it a lot more difficult to actually do later in the day because I've kind of crowded out my stomach with all this garbage and I don't have the room left for this stuff. So if you prioritize the good stuff, it's so easy to actually check all these boxes. Also, you can see this chart's pretty big. I didn't put everything from this chart in my app. It's just not practical. So I took like 6 of the things that I knew I needed to work on and I put them in there. And I focused on just the good stuff. I didn't put like, processed meat and, pastries in here. I'm trying not to eat any of that if I can, but, once a week, not a big deal if that happens. So just a couple other tips to help you out. And you want to get these benefits, you've got to find a way to apply this to your life in a way that works. So thanks for tuning in. See you next time.